Hi everybody, welcome to Health Wanted, the place to be for healthy living. This video explores the causes, symptoms, and treatments of tinnitus, aiming to provide insights and management strategies for those affected by this common yet often misunderstood condition. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. One of the symptoms of tinnitus is hearing noises or ringing in the ears. It is a widespread issue that impacts roughly 15% to 20% of the global population. Although tinnitus is not an illness in and of itself, it frequently indicates the presence of an underlying ailment. These can include age-related hearing loss, ear trauma, or a circulatory system issue. Studying tinnitus entails learning about its causes, signs, and treatments, all of which can assist control and possibly lessen the effects of the condition. Causes of tinnitus. 1. Hearing loss. Presbycusis, an age-related hearing loss, is one of the most frequent causes of tinnitus. Age-related damage or death to the sensitive hair cells in the inner ear that carry sound waves to the brain can result in hearing loss and frequently tinnitus. This slow loss of hearing might produce a continuous buzzing or ringing noise. 2. Exposure to loud noise. Prolonged exposure to loud noises, such as those produced by firearms, heavy machinery, or music concerts, can harm the cochlea's hair cells. This damage can lead to tinnitus and noise-induced hearing loss. This kind of tinnitus might appear right away or gradually worsen with ongoing exposure. Those who are more vulnerable include military personnel, musicians, and construction workers. 3. Ear infections and blockages. Tinnitus can result from an ear canal blockage brought on by an infection, excessive ear wax, or foreign objects in the ear. In these situations, the tinnitus is frequently resolved by treating the infection or removing the obstruction. More chronic tinnitus may result from ongoing ear infections. 4. Medication. Some drugs have the potential to harm the inner ear and induce tinnitus because they are ototoxic. Several antibiotics, diuretics, and high aspirin dosages are common ototoxic medications. Certain antidepressants and chemotherapy drugs may also cause tinnitus, particularly if taken for extended periods of time. 5. Head and neck injuries. Head trauma can affect the auditory nerves, ear structures, or hearing-related brain function, which can result in tinnitus. A thorough medical evaluation is crucial because these injuries can potentially result in other symptoms like headaches, dizziness, and balance problems. 6. Circulatory system disorders. Pulsatile tinnitus is characterized by tinnitus noises that coincide with the patient's heartbeat. This condition can be brought on by excessive blood pressure, atherosclerosis, and irregular blood flow. This kind of tinnitus is frequently more audible in calmer settings and may be a sign of vascular problems that need to be checked out by a doctor. 7. Disorders of the temporomandibular joint, TMJ. Tinnitus can be brought on by issues with the TMJ, which connects the mouth to the skull. This is a result of the joint's proximity to the ear and the shared neural pathways between them. Jaw pain or trouble eating is frequently accompanied by tinnitus associated to the TMJ. 8. Meniere's disease. This inner ear disorder can cause vertigo, hearing loss, and tinnitus. Though its precise source is uncertain, abnormal fluid collection in the inner ear is thought to be the cause of Meniere's illness. Meniere's disease-related tinnitus can vary in severity and be accompanied by periods of extreme vertigo. Symptoms of tinnitus. Tinnitus symptoms differ greatly from person to person. The most typical symptom is sound perception in the absence of outside sound. These noises may consist of ringing, frequently described as a continuous, high-pitched tone; buzzing, a tone and intensity variable sound; hissing, a sound akin to steam escaping and white noise; roaring, a constant, low-pitched sound, like to breaking waves; clicking, rhythmic noises that could be heartbeat synchronized. These sounds can be regarded as having a loud, distracting volume or as a low background noise. One or both ears may experience sporadic or continuous tinnitus. Other symptoms like depression, anger, sleeplessness, and trouble concentrating can result from the illness. Tinnitus can have a major emotional and psychological influence on one's quality of life and ability to go about everyday activities. Diagnosing tinnitus. An extensive examination by a medical expert, usually an ENT or audiologist, is usually required to diagnose tinnitus. The procedure consists of 1. Medical history and physical exam. Research into possible underlying reasons might be aided by a thorough medical history and physical examination. Inquiries concerning medicine use, noise exposure, and any associated symptoms are included in this. 2. Hearing tests. Audiological assessments determine whether hearing loss, which is frequently linked to tinnitus, is present as well as hearing function. These examinations can assist in identifying the precise frequencies impacted and the degree of hearing impairment. 3. Imaging tests, to look for structural problems in the brain, blood arteries, or ears. Imaging tests like MRIs and CT scans may be performed. These examinations can assist in eliminating tumors and other anomalies that may be the source of the tinnitus. 4. Laboratory tests, to look for infections, metabolic diseases, or other illnesses that could be causing tinnitus. Blood tests might be performed. For instance, tinnitus symptoms are occasionally associated with anemia and thyroid disorders. Tinnitus treatments. While there isn't a cure for tinnitus, there are a number of therapies that can help control the illness and lessen its effects on day-to-day activities. Options for treatment consist of 1. Sound therapy. Sound treatment muffles the internal tinnitus sounds with outside noise. Relief can be obtained via gadgets such as specialist ear-level sound generators, white noise machines, and hearing aids. Rain or the sounds of the ocean can also be calming natural sounds. 2. Hearing aids. These devices help people with hearing loss hear better overall and experience less tinnitus. Tinnitus symptoms can be better managed with the help of integrated sound masking technologies found in many modern hearing aids. 3. Cognitive behavioral therapy, CBT. By altering unfavorable thought patterns and behaviors, CBT assists patients in managing the emotional and psychological effects of tinnitus. It focuses on methods for managing stress and coping. 4. Tinnitus retraining therapy, TRT. TRT helps patients become accustomed to the tinnitus noises so they become less noticeable by combining sound therapy and counseling. Retraining the brain to disregard the tinnitus is the goal of this therapy. 5. Medications. While there isn't a single prescription that can treat tinnitus, some can assist with related symptoms including anxiety, sadness, or sleeplessness. These could include sleep aids, antidepressants, and anxiety drugs. Drugs that alter brain neurotransmitter activity have occasionally been employed in experimental settings. 6. Lifestyle and home remedies. Tinnitus management can also benefit from lifestyle modifications. These include limiting exposure to loud noises, using relaxation techniques to manage stress, and staying away from drugs like caffeine and nicotine that aggravate tinnitus. A balanced diet and regular exercise can also improve general health and lessen the effects of tinnitus. Handling tinnitus. Tinnitus can be difficult to live with, but there are a few coping mechanisms you can try. 1. Education and support. Gaining knowledge about tinnitus and establishing connections with support networks helps ease discomfort and lessen feelings of loneliness. Support groups provide a forum for exchanging experiences and coping mechanisms with like-minded individuals. 2. Stress management. Methods like prayer, meditation, and mindfulness can help lessen the tension and worry that tinnitus is frequently linked to. Tinnitus symptoms can be made worse by stress, so it's critical to find practical relaxation techniques. 3. Healthy lifestyle. Upholding a healthy lifestyle helps enhance general well-being and lessen tinnitus symptoms. This includes frequent exercise, a balanced diet, and enough sleep. Particularly exercise can enhance blood flow and assist in stress management. 4. Avoiding silence. Tinnitus can be muffled and less obvious by maintaining a background noise level, such as gentle music or natural sounds. Many people discover that their ability to sleep improves when they have a fan or white noise machine in their bedroom. A common but sometimes misdiagnosed ailment that can seriously lower quality of life is tinnitus. Comprehending the causes, symptoms, and therapies of this condition can aid in managing and perhaps mitigating its effects. Various therapy and coping mechanisms can offer relief and enhance day-to-day functioning, even though there isn't a universal solution. There is hope for tinnitus sufferers as research into new and more effective treatments is still ongoing. People may control their tinnitus and have happy, fulfilling lives by being knowledgeable and looking into their choices. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.